Another medical mystery involving people who contract COVID-19. There are studies out now that suggest patients who had to be hospitalized because of the virus ended up developing type 2 diabetes. Now, that's a reason for concern because according to the Shelby County Health Department, up to 13% of the population has one form or the other of diabetes. Fox 13's Greg Coy is live in the medical district. Greg, you talked to two medical experts who tell you this issue needs to be studied in depth.
Yeah, they want to look at many other factors, of course, age, weight, family, and medical history before making some type of conclusion. But the recent studies that show that patients hospitalized in the ICU with COVID-19 developing diabetes has doctors asking what's causing this and the long-term impact to the patient. It ought to be frightening enough that you can end up in the hospital with COVID-19. Now researchers have found ICU COVID-19 patients who were pre-diabetic, now developing either type 1 or type 2 diabetes.
And that stress leads to the diagnosis while they're in there. They didn't know they had diabetes, or the diabetes was unroofed during the time that they had an acute illness.
I found this study in the medical journal Diabetes, Obesity, and Metabolism that examined 3,700 patients. Researchers noted that the new cases of diabetes among hospitalized COVID-19 patients could be attributed to the stress response associated with severe illness or treatment, but the effect of COVID-19 should also be considered.
But at the same time, we are not seeing a clear-cut data which will determine a cause and effect.
Doctors who specialize in diabetes say further study is needed to find out the long-term effect on the patient.
We have to put people into databases. We have to send blood to the NIH.
Dr. Latif tells me this could be particularly troubling for Shelby County because of the percentage of people living here already diagnosed with either type 1 or type 2 diabetes and those unaware that they have the disease.
So we have to be on the lookout. We have to, monitor those people who may come up with non-specific symptoms of just feeling tired and not feeling well after having had a bout of COVID.
So this is a real medical mystery.
At this time, yes, it is.
A medical mystery they're hoping to solve. Doctors Cohen and Latif says that research like this usually takes years, but considering how much attention has been given to COVID-19 and the pandemic, this hopefully will just take only a few months. Live in the medical district, I'm Greg Coy, Fox 13.